Welcome everyone, and thank you all for attending. It's nice to see you all, especially because I don't know where you all are, but the weather seems to be quite nice today. But yeah, so I'm Lucy and I'm the Let's Talk project facilitator for SAMH. And I'll tell you a little bit about Let's Talk. So it's a 3-year big lottery funded pilot project that covers Glasgow, North Lanarkshire and South Lanarkshire. So these areas have been chosen due to kind of areas of poor mental health, high suicide rates, long waiting lists to see mental health services, but also due to areas of high deprivation as well. So the whole aim of Let's Talk is to kind of tackle the stigma and discrimination that surrounds mental health conditions and people struggling with mental health problems as well, but also to provide the information and the signposting that's available out there within the local community. So the key component is to put people in charge of their own recovery, so to have the right tools and to have the information so that they're on the road to that recovery as well. So one of the biggest things that we try to kind of promote and use within our kind of well-being is the 5 ways to well-being. So this is something that incorporates kind of looking after your physical and your mental health by being active, taking notice, giving, learning, and connecting. So I personally am not a stranger to mental health conditions. So I've had depression for quite a number of years now, and also had family members and friends who've gone through similar experiences as well. But the way that I've kind of had been able to be on the road to recovery and had various coping mechanisms is by using the 5 ways to well-being. So for me, being active was all about kind of going for runs, maybe boxing, or maybe doing some weight training. So something that helped me to keep my body and mind strong and healthy. In terms of taking notice, for me, journaling was quite a key component. So it helped me to kind of note down some of my moods, my emotions that I've been having, and to be able to reflect on them and maybe even make sense. So I will be talking about mental health conditions later on and kind of talking about the racing thoughts that we have. So for me, it helped me to note down those thoughts and maybe reflect on them a month later and see, oh, okay, I see how I was feeling back then. But I also used kind of creative elements as well. So whether it was kind of getting my hands dirty with some clay or using some painting. So it doesn't have to be kind of a masterpiece, but it's just something that helps me to express kind of my thoughts, my emotions in a positive and creative way as well. So for me, giving was kind of giving my time in terms of, sorry, bear with me a second. So giving my time, so in terms of kind of volunteering with the community as well, and be able to kind of help kind of give that support to other people. But in return, I actually helped my own well-being. So I was able to get some skills, get some kind of self-confidence and esteem by helping individuals out in the community as well. So another way was for me in learning. So I do have a background in kind of mental health and psychology. I'm not a professional, but it's just things that I've learned in the past. But the biggest kind of learning for me was learning about my own mental health condition and others around me as well. And learning that mental health conditions are very subjective, they're very individual. And so just because someone might have a similar diagnosis or the same diagnosis doesn't mean that they'll have the same symptoms or maybe react in the same way as well. And finally, connecting was probably the biggest stepping stone in my recovery. So for me, reaching out to someone that I trusted and actually talking about it, because it's something that I kind of kept in the dark, kind of probably due to the self-stigma that I had and worried about what people might think and what might happen with work and volunteering. But actually talking about it and getting out and kind of being able to get other types of support and counselling kind of helped me to expand a lot of those coping skills and other things that helped me in my recovery as well. So we'll be talking about the 5 ways to wellbeing later on and seeing how it can help you and maybe some things that you might already do as well. So hopefully by having these types of workshops, you're already contributing to kind of reducing and ending that stigma and discrimination around mental health, but also maybe trying to equip yourself with some things that you can use kind of with your own well-being, whether that's kind of physical and mental as well.